Okay, so welcome everybody. I'm Dr. Manish Taneja, and welcome. The NEET SS results were just announced, and Critical Care Group did excellent. So we are welcoming Dr. Abhijith S with us. He did a wonderful job by securing a very, very nice rank, which was All India rank 25 in this 2024 NEET SS. So first of all, very congratulations to you, Dr. Abhijit, for doing such an amazing job, and I welcome you.
Thank you, sir.
Hello. So, Dr. Abhijit, before we delve into what you did and what you are feeling, we would first like to introduce the people with you. Can you tell us a little bit about yourself? Where, what background are you from? Where did you do your MBBS from? Or, like batch or something and all that? The
Yeah,
basic things.
I'm basically from Trivandrum, Kerala. I have done my MBBS in 2010. I finished in 2016. Then I joined for DNB anesthesia in the prestigious Breach Candy Hospital in Mumbai. And during my anesthesia postings, only this COVID happened, and I was mainly posted in ICU that time. So from 2020, I was oriented to ICU. I was working more in ICU than my anesthesia during my PG life. Then immediately after my PG, I joined there only as critical care
SR.
resident, no registrar.
Yeah, yeah.
Yeah.
Okay.
And I was working there for a few years, and during that time, I did my IDCCM, which is Indian Diploma in Critical Care Medicine. It's a 1 year course in critical care medicine. And after that, I was working as a intensivist back in my hometown, Trivandrum, Kerala. Since
Mhm.
last 3 years, I'm working here.
Mhm. Okay, nice.
Currently,
Very nice.
hmm, currently I'm
So
working in
you,
HP Mediport, Trivandrum. Yeah.
oh, nice. So, I mean, you have good exposure of critical care. That means, right? I mean, you have been working in critical care for 3, 4 years. So, I mean, that's a great exposure. I mean, uh, we have the similar stories. I mean, we are from the time when COVID stuck around our residencies, and we were stuck in our IC. We were stuck in the ICUs, leaving behind our primary practice, right? So, similar story I have. So, anyways, so yeah. How uh, are you feeling currently by doing such a wonderful job and getting such a wonderful rank? Did you expect it, or was it unexpected? And how
No,
how are you
actually,
feeling?
I didn't expect this much rank. For me, the exam was quite easy, and I thought it will be easy for everyone because those who are working in ICUs for a few years or few months will get many questions correct because they were asking a lot of basic questions, basic ICU procedure related and basic uh, ICU cases related questions. So it was easy to answer those questions.
Yeah. But you did an amazing job. How are you feeling by securing this rank?
Actually, I'm very excited and happy.
Yeah, very nice. Congratulations. So I think
Thank
you
you.
will get what you want wherever you want, I think. Congratulations. So yeah, I mean, let's delve into it a little bit deeper. Let us tell the people who are watching it right now or your juniors how did you prepare for the examinations, and what did you think of the current examination pattern, since there was a change, right, in the examination pattern, and all the dilly-dallying or the postponement, and last year it didn't happen. There was a delay in the examination conduction and everything. How did you, prepare for it? How did you keep yourself centered? What did you do? So all those things. Can you let us know a little bit?
Yeah. Since I was working in critical care, I used to read a lot about critical care topics, the basic things like I was reading those books like Washington's Manual, then the other ICU manual books. And from 2023, I was thinking of joining critical care medicine for super specialty because I think in future with IDCCM there won't be much scope for critical care medicine, and a super specialty degree like either DM or DRNB is necessary. So I was planning for that since last 2 years, and I did subscribe my doc tutorials last year only. That time there was no super specialty group back then, and it was
Mhm.
mainly medicine group. So
Yeah.
I initially subscribed the medicine package, and I found it a bit more difficult because I was mainly from anesthesia group, and I was finding it very difficult since it was mainly medicine oriented. Those tough Harrison topics.
Yeah.
Then when it changed to critical care pattern, I felt happy because I was sure that I will be able to answer more questions compared to medicine topics because I was working in this field since 2020
Yeah.
and after the critical care module was started in doc tutorials, I changed my package to critical care and started doing MCQs. And I found that I was able to answer many questions. And so I was keep reading more critical care topics and hovering through the critical care modules, more procedure related videos and the scoring systems and the ACLS system, which are more critical care oriented than medicine oriented.
Yeah.
And
Nice. Yeah, yeah. Go ahead.
and finally, when it came to exam, the questions were asked from these topics only.
Yeah. So yeah, I mean, it was a blessing in disguise for you, it seems like, right? Because I mean,
Yeah,
uh, when we gave the exam was basically medicine based, and it was a good thing that they changed it to critical care background because a lot of people who choose critical care are not from medicine, right? Are from
yeah,
either anesthesia, emergency medicine, or pulmonology. So it's a good thing. It's a blessing in disguise that this happened, and the pattern change is a welcome thing, I think. So, anyways, you said that right. You could get a lot of questions right because I believe that there is no substitute for exposure or experience, right? As you get
yeah,
more experience in the specialty you plan to work, you tend to get those basics correct, and you always have to focus on the basics. So, asking, coming to the basics, what did you think of how the exam was, structured, or what did you think about the question paper of critical care this year, which you had to face?
yeah. I think we should focus on the core critical topics like sepsis, ventilation, ARDS, infections, and the post-op management, surgical patient post-op management, such thing, fluid management. All these are important for the critical care patient, and obviously we have to know about the lines and the equipments associated with the critical care thing. So mainly, I
Yeah,
will suggest everyone to have a little critical care orientation by working in critical care, where good exposure of patients are there, good variety of patients are there. So we will get more practical knowledge also than theoretical knowledge.
definitely, definitely. Critical care is a very hands-on field, right? You have to do a lot of things instead of just reading about them, right? So, I mean, exposure or experience is always a good thing to do. But what did you think about the MCQs? Like, did MCQs did they guide you in your preparation, or were they helpful in making you understand what the question paper will be like, or something?
Yeah, reading just theory won't bring the questions, the topics in our mind. Doing MCQs will make us focus on what area they ask question, and we can stress on those topics where more MCQs are coming.
Yes. Yeah, that is definitely the case because, I mean, uh, when you are faced with that scenario, I mean, it sort of, it sort of makes into your long-term memory, or it sort of makes home in your head, right?
Yeah.
When you are
Yes, sir.
faced with that scenario. So solving MCQs is a very important thing in my opinion. So,
Yes.
Dr. Abhijit, can you tell me how did you, because there was a change in the exam pattern and there was a delayed exam and all that, how did you keep yourself, calm and occupied in all those?
Since I was working, uh, like there was no much issue for me because I was
Yeah.
ready anytime for facing the exam. because since it was critical care based, I was okay with the exam pattern. Like rather than attending a medicine for critical care, I was more happier to attend a critical care question paper.
Okay, nice. So, one more question. I mean, I don't know, but it might look out of place. But why critical care?
Because I like working in critical care. It's like a every case is a mystery. We have to
Yeah.
diagnose patient. We can do procedures also rather than just uh, sitting in an OP. I find it more more interesting in working in a place and finding out the solving the mystery, solving the cases, doing procedures, and making the critically ill patient healthy is giving better satisfaction than treating OPD cases for me. So I find critical care more enjoyable.
Yeah, I mean, the adrenaline in critical care and the emergent or acute care specialties is next level, right? But the stress is also next level. So I wish you all the best, and I hope that you are experienced already. So I don't think that there will be an issue with that. So, what about the videos? Did you go through any videos or anything? Do you think?
Yeah, I saw mainly cardiology videos and the ATLS videos and the uh, procedure related videos just to refresh my memory
Were there any?
and
Were there any?
scoring them.
Were they helpful or anything? Did you find them
Yeah,
helpful?
definitely helpful because
Yeah,
this more exam oriented videos are more important than just
yeah,
reading.
yeah. So, I mean, according to you, according to our discussion currently, what I understand is you are telling people to focus more on core critical care uh, topics and
Yes,
focus more on the basics and do solve a lot of MCQs, right? Is
yes,
that
sir.
your recommendation?
Yes, sir, definitely. Work in an
Okay.
ICU, get
Yeah.
exposed to all the kinds of equipments, machine, all the types of cases, and
Yeah.
then read and practice MCQ. That will give a better chance.
Okay. Anything else? Any advice that you would like to give your juniors or anything?
Um,
Anything life related, anything about how to keep yourself centered or anything related to exam or anything.
no, just keep practicing and keep up to date with the topic. Critical care is a subject where it is a fresh subject. New a lot of research is coming on. The practice is changing every day. So
Mhm.
it's a changing branch. It's a new emerging branch. So
Yeah,
I think
definitely.
there is a lot of scope for research also. So those who are
Mhm.
interested in such things can always choose critical care.
Very nice. So I think that I congratulate you again once again, for securing such a great rank. Were you like keeping something in mind, or were you focused on a rank when you were preparing, or were you just enjoying the journey and reading about or learning or enjoying the procedure of learning or something?
Mainly, I was just going through the topics to learn more about critical care. I was not
So the
focusing on the
journey.
rank. Yeah,
Yeah, so the journey is more important than the destination, right? But
yeah.
you did amazing. So, yeah, it's such a nice feeling. I mean, I think you must be feeling really great. So, yeah, enjoy your day. I think that should be enough for tonight. And yeah, I hope people get inspired by your journey, and uh, people learn from you and can get rank for themselves. I congratulate you for the rank, and I wish you all the very best for your future. Thank you very much for joining us, Dr. Abhijit.
Yeah.
I
Thank you, sir.
think,
Thank you.
yeah, thank you so much. Good night. You can
Thank you.
leave the
Good night.
studio, I think. Yeah, good night.